I'm Dr. Rami Batniji, board certified by the American Board of Facial Plastic and Reconstructive Surgery, as well as the American Board of Otolaryngology, Head and Neck Surgery. I have practices in Newport Beach and Beverly Hills, California, and Juvederm Voluma XC is one of my favorite fillers. In this video, I'll be talking about how to optimize outcomes with Juvederm Voluma XC in the cheeks and the chin. Juvederm Voluma XC is the first and only FDA-approved filler to add volume to the cheek and shape the chin. It is a firm, structural gel specifically designed to add volume. It is the longest-lasting hyaluronic acid filler with proven duration up to 2 years in the cheeks and up to 1 year in the chin with optimal treatment. In each of the pivotal clinical studies, patients reported improved satisfaction with their cheeks and chin. As you know, understanding facial anatomy is crucial to safe and effective injections. Let's review anatomy in the cheeks and the chin. Anatomy can help guide your injection strategy. You may inject Juvederm Voluma XC subcutaneously, which is above the muscle and/or the superficial musculoaponeurotic system, or supraperiosteally, which is below the muscle and/or SMAS. The depth at which you choose to inject will be dependent on the aesthetic goal you are trying to achieve. In this image, you can see the different layers of facial anatomy in the cheek area, including muscles, fat, and ligaments. And in this image, you can see the different layers of anatomy in the chin. Once you've identified the relevant tissue planes and structures, ensure you identify areas of caution. In the cheek area, note the location of the facial artery as well as the infraorbital foramen and neurovascular bundle, which is usually slightly less than a finger breadth below the orbital rim and medial to the midpupillary line along the vertical plane of the medial limbus. In the chin, note the location of the mental and submental arteries, which supply this area. Particular attention should be paid to the facial artery and marginal mandibular facial nerve branch. In addition to understanding facial anatomy, it's important to understand how the face changes over time, as these changes are often related to the patient's aesthetic goals and your injection strategy. As shown here, the youthful face typically features a full upper cheek above the lower portion of the midface. On the right, we can see that as people age, fat atrophy often occurs in the cheek area. Over time, volume descent, as well as other factors such as sun exposure, smoking, alcohol use, and diet and lifestyle imbalances contribute to wrinkles and folds in the lower face. As a result, the facial triangle of a young face, or triangle of youth, inverts, and the volume that was once in the midface repositions and moves down. The heaviness in the lower face causes a prominent, sagging appearance. The appearance of the chin is affected by decreased mandibular height and projection. I really love this image because it highlights specific facial changes by comparing a daughter in her 30s to a mother in her 60s. The younger woman's face is defined by malar eminence, a well-shaped OG curve, minimal wrinkles, aesthetic contours, and balanced volumetric proportions. Her mother's face is defined by concavity and deflation in the cheek area, wrinkles and folds, soft tissue ptosis, and exaggerated prejowl sulcus and chin retrusion. Talisha and I had the opportunity to discuss her areas of concerns, and some of the things that she highlighted to me was she felt like she had lost some volume to her cheek tissues. She felt that they had fallen down. And she aspires for some more definition of her cheekbone structure and a bit of restoration of the volume that was lost in her cheeks. Furthermore, she talked about facial shape and how she'd love to see a little bit more definition to the chin. She felt like she had a lack of definition to the chin, which impacted the appearance of her overall facial shape. So what we'll do now is an assessment of Talisha's cheeks. And the first area that I assess is the zygomaticomalar area. In the zygomaticomalar area, I look at it in a 3/4 view or an oblique view. And I'd like to see a bit of an OG curve when I'm looking at the zygomaticomalar area. And Talisha has really beautiful cheekbone structure, but she just has a little bit of lack of soft tissue definition in the zygomaticomalar area. I'm actually looking at it from this posterior view in an oblique angle, and I'd love to see a little more OG curve in this area here. Furthermore, I see some lack of volume in the anteromedial cheek, specifically the deep medial cheek fat pad. Talisha probably has an active lifestyle, and as such, her body fat percentage is a little bit lower, and the area that we tend to lose that fat is the anteromedial cheek fat pad or the deep medial cheek fat pad. Also, we get some descent of that tissue as well, which further accentuates that lack of volume in the anteromedial cheek. So these are two areas where I believe Talisha would benefit from the use of Juvederm Voluma XC to address the zygomaticomalar area as well as the anteromedial cheek areas. Now, when we assess the chin, I look at a variety of things. Firstly, I look at the width. I'd like to see the width of the chin to be about the same width of the medial canthus. I'd also like to look at projection of the chin, and that's from a profile view. From the profile view, I'd like to see the lower lip approximately 1 to 2 millimeters more anterior than the most anterior part of the chin, which is the peconian. The peconian is the most anterior aspect of the soft tissue of the chin. And we see that there's some more discrepancy between the projection of the lower lip as it relates to the peconian, and that's an area where Juvederm Voluma XC can benefit and improve upon that discrepancy. Another thing we look at is length, and we look at that from the menton, which is the most inferior aspect of the bony mandibular symphysis. And we see that there's just some slight shortening of the chin in this area here, and we can improve upon that length with treatment of the menton using Juvederm Voluma XC. And finally, we see some shadowing of the mental crease on both sides and some lack of definition along the prejowl sulcus areas here. And we can use Juvederm Voluma XC using a blunt cannula to address those areas of concern. One final thing before I inject today. It's also important to always practice aseptic technique. These are some of my must-do practices. Wash your hands thoroughly. Remove all jewelry and put on clean gloves. Clean the patient's entire face and make sure all makeup is removed. Then, apply an alcohol-based antiseptic to the entire face. Initiate treatment in areas away from the bacteria-prone nose and mouth. Clean and re-clean each injection site immediately before treatment. This is called continuous prep technique. Throughout treatment, be aware of what you touch with your hands and the needle or cannula. With cannula specifically, be mindful of what the cannula is touching as it is being introduced. Ensure the cannula does not touch the patient's skin at the entry point or during retrograde injections. You want to minimize any introduction of bacteria into the entry point. Last, change gloves and needles or cannulas often. Now we'll proceed with treatment of Talisha's cheeks. First thing I'm going to do is cleanse the skin with an alcohol wipe. Sterility is really an important thing for us, so the next thing I'll do is use a sterile gauze to just dry the area. Then I'll mark out with a marking pen the zygomatic arch. Talisha, look up for me. As she looks up, it accentuates the infraorbital rim. And as she looks up, I can draw out the lateral limbus straight down to the floor right here. This will be a landmark for me when I'm injecting the anteromedial cheek. Now, with the zygomaticomalar region, we are going to use Juvederm Voluma XC with the 27 gauge half-inch needle. Before I do the injections, I'm going to cleanse the skin with the chlorhexidine. I'm going to cleanse the skin with chlorhexidine. I load the 27 gauge half-inch needle on the Juvederm Voluma XC syringe. I will do serial puncture technique. I want the definition of the zygomaticomalar region to be right about here. Pass the needle through the skin, down to the bone. I'm not touching the area where I'm injecting. I'm aspirating to ensure I'm not in a blood vessel, and I'm injecting slowly. And as I'm injecting, I'm looking at how much product I'm injecting as well as the aesthetic result. I want to inject anywhere from 0.05 cc's to 0.2 cc's. So here I am at 0.2 cc's. I'm going to lift off the bone. I see a projection that I've gotten, but I'd like to get a little bit more. So I'll go adjacent to where I placed that product, go down to the bone again in this area here, aspirate. Talisha, everything's looking really, really good. I've aspirated and now I inject slowly again. Thus far I've injected 0.1, and I suspect I'll inject 0.2 cc's total at this site as well. I'd like to see a little bit more projection, so I'm coming right here again at the zygomaticomalar region and aspirating. And again, injecting an amount of product in this area here. I'm not putting pressure at the previous injection sites because I don't want to push down on the Juvederm Voluma XC and negate the projection that I'm achieving, but I am just dabbing it gently. I'm going to place just a little bit more product posterior to the most posterior aspect to create a gentle curve to the zygomaticomalar area here. And again, I aspirate and inject slowly. And this again will be 0.2 cc's, this injection point. Throughout the entire injection, I'm assessing the aesthetic result by looking at the zygomaticomalar area from a 3/4 angle. In my case, I'm looking from behind in an oblique angle to assess that nice convexity that we've now achieved on this right side. And I can compare the two sides from above, and I can see this nice projection of the right zygomaticomalar region. So now that we've completed that injection of the zygomaticomalar region on the right side, we'll proceed with injections to the anteromedial cheek on the right side. Now we have an option in the anteromedial cheek of using a blunt cannula or using the given 27 gauge 1/2 inch needle. In Talisha's case, I'm going to use the given 27 gauge 1/2 inch needle and go down to the bone in the anteromedial cheek. My reasoning for that is she has thicker skin, which will allow us to place these droplets or micro droplets of product against the bone to provide further lifting of the anteromedial cheek. My entry point in the anteromedial cheek will be at the line of the lateral limbus, which is the outer colored part of the eye. That's the line that I drew down in this area here. I see where the anteromedial cheek has its most concave area, which is right about here. So that'll be my entry point. We know the infraorbital foramen is in this area here, so I want to ensure that I'm down to bone, which means I won't be in the infraorbital foramen. So I'm going to inject 0.2 cc's here. Again, it's against bone. Now what I'm going to do is lift off the bone and reposition the needle superiorly and medially and re-engage the bone. Do you feel a tickling sensation in the lip, nose, or cheek?
No.
I'm against the bone. I aspirate and I inject again. Do you feel a tickling sensation in the lip, nose, or cheek?
No.
My frequent asking Talisha of that question allows me to get a sense of how close I am to the infraorbital nerve and the infraorbital neurovascular bundle. And that's a total of 0.2 cc's in that entry point there. And now I reposition again a little more superiorly and medially, re-engage the bone. And now one thing I can do, whereas I didn't want to massage in the zygomaticomalar area, I can massage the product a little more superiorly and medially in the anteromedial cheek region. We've completed the treatment of the zygomaticomalar area on the right side as well as the anteromedial cheek for Talisha using Juvederm Voluma XC. And one thing I'd like to do is now review the aesthetic result and compare it to the untreated side. So Talisha, do us a favor and bring your chin down. Now look up. And now what we can see when we compare the treated versus the untreated side is the lifted, more contoured, more defined areas of the zygomaticomalar area, as well as specifically the anteromedial cheek and how that anteromedial cheek appears more lifted, we've shortened the distance between the lower lid cheek junction using Juvederm Voluma XC in the anteromedial cheek. And we used, again, a total of 0.8 cc's in the zygomaticomalar area and a total of 0.6 cc's in the anteromedial cheek region. Now we'll proceed with the treatment of Talicia's chin. Talicia, do me a favor and open your mouth just a little bit. I see where the teeth are, I see where the columella is. This is the midline right here. And now what I want to do is mark out the pagonian, which is the most anterior projecting aspect of the soft tissue. In order to do that, I assess from the profile, and the pagonian is right about here. The next thing I want to mark out is the menton, which is the most inferior aspect of the mandibular symphysis, the bony mandible, which is down here. Treatment of the pagonian will provide us more harmony between the projection of the lower lip and the pagonian. Treatment of the menton will provide us a little more length, which will enhance her facial shape. We'll also mark out the mental crease, and we'll mark out the pregial sulcus, which she has a very minimal amount of pregial sulcus, so she'll need very little product in this area here. I'm marking out the inferior border of the mandible here and the upper part of the pregial sulcus region there. Our first injection will be the pagonian. I will use a 27 gauge half-inch needle and place the Juvederm Voluma XC in a supraperiosteal injection. Talicia, you're going to feel a little needle stick here. I'm going to pass the needle through the skin, not where the markings are, but just adjacent to it. Go down to the bone here. I'm against bone. I aspirate, and I'll inject an amount of product to get the projection of the pagonian that we aspire for, so that we get more harmony between the projection of the lower lip and the pagonian. Notice that I'm injecting slowly. I'm assessing the aesthetic result achieved from the injection. This is, again, a supraperiosteal injection of product at the midline, at the pagonian, to provide more projection of the soft tissue in this area here. And I've injected a total of 0.4 cc's. And I look at that projection, and we've got a nice amount of projection there. I would like to see a little bit more projection of the pagonian. So I have another 0.2 cc's that I think she would benefit from. So I again pass the needle through the skin, aspirate, no return of blood, and I inject slowly. And that provides us some nice balance of the pagonian to the lower lip. Now we'll proceed with treatment of the menton. We'll again use the 27 gauge half-inch needle. The menton is the inferior aspect of the mandible. We marked it out here, the mandibular symphysis. We're just applying some light pressure at the injection point of the pagonian. Now we'll proceed with injection of the menton. Down to the bone. Again, this is the most inferior aspect of the mandible, the menton. We aspirate and we inject. And again, this is a sterile gauze. We injected a total of 0.6 cc's of Juvederm Voluma XC at the pagonian. I'm feeling with my non-injection hand or finger the inferior border of the mandibular symphysis. This will provide some mandibular length, which will help with facial shape. We placed a total of 0.4 cc's in that area there. And looking at her profile view, we're seeing some nice balance between the menton, the begonian, and the lower lip. I'll change the needle. And we'll put just a little bit more product in the begonian. Now that we've completed the treatment of the begonian, we'll proceed with treatment of the mental crease. For the treatment of the mental crease, I do like to use a blunt cannula technique. So we'll use a 25 gauge blunt cannula and a 23 gauge sharp needle as our entry point. We'll cleanse the skin where we plan to enter our needle, our blunt cannula, for the mental crease as well as the pre-jowl region. We use our 23 gauge needle as an entry point, just to the lateral aspect of the mental crease. That's our entry point. Left Talisha just turns slightly away from me. Perfect, good. This is our sterile gauze. And we enter. We're in the subcutaneous plane. We go to the midline and we inject in a retrograde fashion. So I'm injecting as I'm slightly withdrawing from the superior line to the inferior line, which demarcates the borders of the mental crease. I'm ensuring that the blunt cannula is not touching the skin as I'm advancing and withdrawing, so I'm decreasing the likelihood of bacteria being introduced. I'm also making sure that I'm not injecting product close to the entry point so that I'm not putting product too superficial. And this is a total of 0.5 cc's. And we'll hold a little pressure here, gentle pressure here. And the next area we will treat will be the pre-jowl sulcus, which again, she doesn't have much hollowness in the pre-jowl region, but we will provide, through linear threading technique, a little more definition of the pre-jowl region. We'll use a blunt cannula for this technique, which again is our 25 gauge blunt cannula. We use another chlorhexidine wipe prior to our injection. We have our 23 gauge needle to serve as our entry point, and we want to enter just slightly lateral to the pre-jowl region. Here's our entry point. We then pinch the skin so we get a sense of where that entry point is. Use my other hand for counter traction. Introduce the needle in the area where the entry point was made. Sometimes we need to make the entry point again. We'll make the entry point for the pre-jowl sulcus treatment just slightly lateral to the pre-jowl hollowness. There's our entry point. We use a little counter traction here. Pass the needle through the entry point. I use my non-injecting hand to feel the inferior border of the mandible. I advance the blunt cannula along the inferior border of the mandible and inject in a linear thread technique in a retrograde fashion to soften that transition of the pre-jowl sulcus or pre-jowl hollow and provide some further definition to the chin. This is in a retrograde fashion treatment of the pre-jowl area. And we use a total of 0.5 cc's of Voluma. We've completed the treatments of Talisha's begonian, menton, right mental crease, right pre-jowl region. So now we'll proceed with the treatment of the left mental crease and the left pre-jowl region. Now we'll proceed with treatment of the left zygomaticomalar region and left anteromedial cheek region. We'll now cleanse the skin for her with an alcohol wipe so we can remove our markings. We can assess our aesthetic results achieved from our treatments of the cheeks and the chin. Thank you so much for joining me to learn more about Juvederm Voluma XC for cheeks and chin. As you've seen in this video, this is a truly unique product with so many clinical benefits to offer our patients. With your learnings here, it's my hope that you can contour confidently with Juvederm Voluma XC.
Juvederm Voluma XC important information. Indications. Juvederm Voluma XC is indicated for deep, subcutaneous and/or supraperiosteal injection for cheek augmentation, to correct age-related volume deficit in the midface, and for augmentation of the chin region to improve the chin profile in adults over the age of 21. Important safety information. Contraindications. This product should not be used in patients who have severe allergies, marked by a history of anaphylaxis or history or presence of multiple severe allergies, and should not be used in patients with a history of allergies to gram-positive bacterial proteins or lidocaine contained in this product. Warnings. Do not inject into blood vessels. Introduction of this product into the vasculature may lead to embolization, occlusion of the vessels, ischemia, or infarction. Take extra care when injecting soft tissue fillers. For example, inject the product slowly and apply the least amount of pressure necessary. Rare but serious adverse events associated with the intravascular injection of soft tissue fillers in the face have been reported and include temporary or permanent vision impairment, blindness, cerebral ischemia or cerebral hemorrhage leading to stroke, skin necrosis, and damage to underlying facial structures. Immediately stop the injection if a patient exhibits any of the following symptoms: changes in vision, signs of a stroke, blanching of the skin, unusual pain during or shortly after the procedure. Patients should receive prompt medical attention and possibly evaluation by an appropriate healthcare professional specialist should an intravascular injection occur. Product use at specific sites in which an active inflammatory process, skin eruptions such as cysts, pimples, rashes, or hives, or infection is present, should be deferred until the underlying process has been controlled. Precautions. To minimize the risk of potential complications, this product should only be used by healthcare professionals who have appropriate training, experience, and knowledge of facial anatomy, and the product for use in deep injection for cheek and chin augmentation. The potential risks of soft tissue injections should be discussed with patients prior to treatment to ensure they are aware of signs and symptoms of complications. The safety and effectiveness for the treatment of anatomic regions other than the midface, chin, and prejowl sulcus regions have not been established in controlled clinical studies. The safety for use during pregnancy, in breastfeeding females, and in patients with very thin skin in the midface region has not been established. The safety for use of Juvederm Voluma XC in patients with known susceptibility to keloid formation, hypertrophic scarring, and pigmentation disorders has not been studied. The safety for use of Juvederm Voluma XC has been established for use in patients between 35 and 65 years of age for cheek augmentation and patients between 22 and 80 years of age for chin augmentation. As with all transcutaneous procedures, dermal filler implantation carries a risk of infection. Use with caution in patients on immunosuppressive therapy. Patients who are using products that can prolong bleeding, such as aspirin, nonsteroidal anti-inflammatory drugs, and warfarin, may experience increased bruising or bleeding at treatment sites. Patients who experience skin injury near the site of implantation may be at a higher risk for adverse events. The safety of Juvederm Voluma XC with cannula for cheek augmentation has not been established in patients with Fitzpatrick skin types 5 and 6. Juvederm Voluma XC was not evaluated in subjects with significant skin laxity of the chin, neck, or jaw in the chin augmentation study. The effect of Juvederm Voluma XC injection into the chin on facial hair growth has not been studied. Patients may experience late-onset nodules with use of dermal fillers, including Juvederm Voluma XC. Adverse events. The most commonly reported side effects were tenderness, firmness, swelling, lumps, bumps, pain, bruising, redness, discoloration, and itching. The majority were mild or moderate in severity across all studies and resolved within 2 to 4 weeks. To report an adverse reaction, please call Allergan at 1-800-433-8871. Please visit juvedermdfu.com for more information. Juvederm Voluma XC is available only by a licensed physician or properly licensed practitioner.